G'day guys, welcome back. This is Stu from Plan Manager Assist. Here with me today, I've got Lindsay from The Caring Way. Lindsay, welcome. How are you going?
Hey Stu, great to be here.
Fantastic. And the one thing I want to look at today with Lindsay and with The Caring Way is the idea that you can have support workers that aren't necessarily, and I say this with the greatest respect, just support workers. We actually can have supercharged, superpowered support workers by having nurses.
Absolutely. Since I have started working as a support worker, I actually feel that I've got my oomph back as a nurse, and honestly, it sometimes feels more like real nursing than what I actually do at the hospital.
Fantastic. And so with the nursing, so in terms of the qualification you have, just for the people that understand, so what level of nurse are you?
I am a registered nurse. I'm an RN, yeah.
So an RN doing the support work. So in terms of what does that look like for you for a typical shift? Is there a lot of difference for a nurse that is doing support work? What does that look like for you?
Well, it looks different in that typically in the NDIS, nursing shifts tend to be pop in, pop out. Pop in, give someone an injection, pop in, do a dressing. Whereas support work, you're possibly there for 4 or 5 hours doing whatever needs to be done. And for the families, the good thing about nurses is we never say that's not my job, because at the hospital, if anything needs to be done and it's not clear who's got to do it, we do it. So I don't know about the others, but with me, it's the same. I'll walk the dog, change the nappies, look at the participant's sister's sore toe, and just, whatever needs to, as well as what I'm actually being contracted to do.
So for a particular shift, for example, a participant may need just general sort of domestic stuff. They might need that extra level of care with that, that changing of wound dressing. They might need that medication assistance. So theoretically, you could do it all.
Absolutely, I can do it all. Like one of my people that I normally clean for example, had a skin cancer removed. I popped in and changed his dressing a couple of times.
Okay.
No biggie.
Yeah, no biggie. Okay, so with as you said before, the idea of nursing shifts can be that pop in, pop out, and with a support worker shift, it's that longer sort of shift.
Yeah, and also if you're doing the support work shifts, you sort of get to know everybody better, the whole thing, because you're with the participant on a regular basis. Like there's some families I might be visiting 3 times a week for maybe 5 hours a day. So there is a relationship there, which is really handy, because it means if they need any nursing reports, I don't need to go around extra. I can look back on all the support work I've done and write the reports quite easily for them.
It's interesting because that actually leads to where I was going to ask next, which was how does the paperwork look in terms of writing reports, or in terms of doing those sort of follow-ups and in terms of I imagine that being an RN, you'd have a greater depth of detail to the work and the paperwork that you do.
Well, that's the thing. I simply document what happened. My documentation is, I would write the same whether I'm working as a nurse or a support worker. And I also know how to access help with various things, and I know my way around at least the public and private system.
Yeah, and I can imagine that for maybe there's a disability in the family a bit more unique, or it might be some that there are maybe some comorbidities there where having that knowledge or having that expertise might make things a little easier for the family to handle and understand.
There is one family that I'm working with at the moment, and at the moment they only need a support worker, which is great, and I'm more than happy to do whatever they need. But the understanding is that in the future they may need a nurse, and because I'm trained and know the family, I would obviously be the nurse for them.
Exactly, and it makes the choice a lot easier for those participants. And so in terms of working with support coordinators and that communication between them, so they understand that they are putting you on as a support worker and that they're using those codes, they're using those lines.
Absolutely, that's the code I'm going for, yes.
Okay, so then Lindsay, in terms of what other nurses that are out there that may be thinking that they might not be getting enough of the drop in, drop out. It might be that they feel that they're not getting enough engagement with participants. What would you say to them, the nurses that are out there that are considering the idea of maybe doing a blended or maybe adding support work to their repertoire as an idea? What would you say to those people?
I would say do it. And I would also say find what kind of participants, what kind of things do you like to do? For example, do you love cleaning and ironing? There are people, I personally find ironing super relaxing. So that is something that I've added to my repertoire.
Definitely for the future.
I do a cleaning and ironing job. And when I'm choosing more hands-on support work, I love kids, so I do children rather than adults. So basically choose what you like doing and and do it, and I'm sure you'll love it too.
Yeah, and so in terms of the advantages, I mean, obviously we know that there's going to be some differences between the two, but what would be the advantages of doing this support work? Would you say that it's more about being able to follow your passions, or is it?
Yeah, it's about following your passions, because we all know nursing isn't like it used to be. The patients are sicker, older, heavier, and possibly a little bit more entitled as well than they used to be. Whereas you're in people's homes, it's a lot more chilled.
Absolutely. Okay. And in the space of being transparent with nurses that are out there considering this idea, they do need to understand, obviously, being a support worker is a different rate to being an RN. It's not the same.
It is not the same rate as being an RN, but it is pretty similar to what you get paid in the hospital.
Okay, so if you're a nurse that's maybe working in the hospital system and maybe you are a little burnt out, or
Yeah.
maybe you're finding it's a bit too much, because let's be real, nurses are overworked, underappreciated, underpaid. And it doesn't matter where you are as a nurse, if you are looking to increase your hours, if you're looking at potentially the idea of following your passions and not being so boxed in, maybe this is an opportunity for you to have a look at. And if you're not quite sure, I mean, you could always come and ask Lindsay some questions from the Caring Way. So, Lindsay, in terms of the work that you do and the work that your organization does, how would participants, nurses, how would they reach you?
They can reach me either on my phone or on my email. Text me on 0414 479 545. And if they send me a text, I'll get back to them as soon as I can.
No worries. And do you have any other socials that they can access? Do you have?
Yes, I am on LinkedIn as Lindsay McPherson and The Caring Way. I'm on Facebook as The Caring Way.
If you are looking at this on YouTube, we will put also a link to The Caring Way in the description below. But in the meantime, Lindsay, thank you so much for coming on. Really appreciate your time. Thank you again.
Thank you so much.